Hello and welcome. My name is Heather Hall. I'm a registered dietitian and a certified LEAP therapist, and I specialize in teaching you how to beat chronic disease and eat your way back to health. This video is for my clients who have completed their 4-week jump start and are now ready to start their LEAP protocol. So you should have received your results from your Mediator Release Test in the mail by now. And so grab those as we go over how to read them and what they mean, and that will get you prepped for our one-on-one phone consultation. So we talk about LEAP and MRT a lot, and so just to make that clear of what that is, MRT is the test results, and LEAP is the diet that we design around those results. So the results that you received in the mail, you should have received a little packet that looks like this, and in there you will find a 2-page list of results from 170 different foods and chemicals that were tested in your blood to see your reaction to them. So the way that you read this, you can see that they're divided out by section. You've got grains, seafood, dairy, flavor enhancers, vegetables, and so forth. And as you look through these results, you can see that each food listed came back with a different colored bar. And that bar is a measurement of how much you reacted to that food, how much your immune system reacted to that food. So if it's in the green section, that's considered non-reactive. Yellow is considered moderate reactivity, and red is considered very reactive to that food. Now, most food sensitivity tests that you're going to get, you'll come back with these results and you will be instructed to basically eat as many any food you want except for whatever comes back red. They say, avoid those foods, and then anything that's yellow, only eat it a couple times a week. That's how most IgG food sensitivity tests work. The Mediator Release Test is, we take a different approach. First of all, I prefer to use Mediator Release Test because it's crazy accurate from what I've seen with my patients so far. I've used both kind of tests, and the IgG test just did not give us very good results. I really didn't see much of a difference at all. The Mediator Release Test, however, was a whole different story. So we tried it first for my husband because I had looked into it. The science behind it made a lot more sense to me than the IgG, and so we gave it a shot. And my husband has an autoimmune arthritis that within a couple of weeks, although we had been working on it for months, his joint pain was so much better. And I went on to test it on some other clients and family members, and just found it's just crazy accurate. It's really effective. And so that's why I use Mediator Release Test. And then I like to combine it with the LEAP protocol, because the LEAP protocol isn't an avoidance diet. We take an opposite approach. So what we will do during our consultation is we will sit down, look at your results, and come up with an anti-inflammatory food plan based upon what foods are safe for you. So this test is a pretty big test because it tests for 170 foods and chemicals. And so that gives us a lot of foods to work with. And then we will try to stick with very low green reactive foods for the first 2 weeks so that we know that you are eating a very, very low inflammatory diet based upon what your body does not react to. And we stick just to those foods we know are safe on these test results. And what that does is really gives people a chance to just feel good again, to almost reset their immune system, it seems like, and just bring all of that inflammation way, way down, and it gets people feeling good really quickly. For those people where it doesn't make a big difference right away, Sometimes you just need a little more time. You just got to stick with it a little bit longer. It can take up to 6 or 8 weeks before you start to notice a difference. And sometimes it's because we need to clear out an infection possibly, or maybe a heavy metal toxicity or something else, maybe a nutrient deficiency that is keeping you from feeling well. Now, when you get your results in the mail, it will also come with a handy little book that looks like this. Definitely flip through there. There's tons of great resources, recipes, food idea lists, all sorts of useful information in there. And what I want you to ignore though is anything in here that talks about the reintroduction schedule or rotations, because we are going to create our own reintroduction schedule and we're not going to worry about rotating foods at all. The science behind that is just not very sound. It makes it really difficult to stick to a diet, and there's a better way. So that's an let me show you. So behind these lists of your results, you'll see a couple pages that look like this, very colorful. They talk about phases and reintroduction schedules. What I want you to do is just rip these 2 pages out of your results and just throw them away. We're not going to use them. They'll probably just confuse you. And we're going to create our own plan. This one's created automatically by the computer, but we can come up with a better one together. Now, another thing I want you to keep in mind as we start to create your LEAP protocol is that the first 2 weeks will be more strict and limited in the foods that you have, because we need to make sure that we're keeping just a very low inflammatory, safe foods for you. And sometimes mentally that can be tough for people because they feel like, oh, I can only eat this. Keep in mind this is a very temporary phase, and the more strict you are sticking to it, the quicker you're going to feel better. And then we will start to expand your diet out. So as soon as you are feeling a lot better, then we can expand out your diet and you become your own tester for food reactions, because we've kind of cleared the noise out, whereas before you couldn't tell which food you were reacting to because everything just seemed to be causing a reaction. But now that you feel good and you know which foods are safe, then we start bringing foods back in, one food at a time, and you can tell if that food makes you sick or not, if it causes symptoms. Another thing to keep in mind when I talk about does that food cause symptoms or inflammation for you, keep in mind that a food sensitivity can happen anywhere in the body. So remember that symptom survey that I had you fill out and that I will have you fill out before every appointment? Those symptoms are tracking all over the body, and symptoms for food sensitivities can happen anywhere in the body because we're talking about your immune system reacting to a food, and your immune system is everywhere. So, don't ignore it if you get a headache or something that's unrelated to the condition that you're seeing me for, because that can still be connected. Now, the reason that I had you do the Jumpstart program first is so that we could get an anti-inflammatory diet, kind of a general anti-inflammatory diet in place, and some really good habits that are going to help you to stay balanced and healthy through the elimination phase. So I want you to keep doing that plate method and the PFC and trying to get the right amounts of veggies and the different food groups balanced in every meal. That will be more difficult for some than others during the initial phases of your LEAP protocol, but almost everybody has enough foods within the different food groups that they can still create a balanced plate at every meal. And this is going to help you stay nourished and help you to feel good throughout your LEAP protocol, even when your diet is more limited. Now, I'm not a fan of very limited diets for a long time. It will cause more problems than it will help. And so our goal is to get you feeling good as quickly as possible and to get your diet expanded out as quickly as possible. That's why we did Jumpstart first, is to lay that strong foundation so that you can get feeling good very quickly and you already know what to do in order to be balanced through this protocol. Now, just because you react to some of those foods with reds, yellows, even high greens right now, doesn't mean that you will always react to those foods. In fact, most people are going to be able to work almost all of those foods, even the ones that you're very red to, back into your diet. We just have to give your body some time to heal and your immune system some time to just simmer down a little bit so that it's not reacting to all those things, so that your gut is sealed up and things aren't leaking through for your immune system to get angry at. And eventually you'll be able to bring those foods back in with no problems at all. Now, for some people, there's always going to be 1 or 2 foods that they just don't handle well. And so that's why we reintroduce one at a time, very systematically, very carefully, so that you know if it causes a problem. For the yellow foods, we wait at least 3 months before reintroducing any of those. For the red foods, we wait at least 6 months to reintroduce any of those. If you ever reintroduce a food and you find that you react to it, take it back out for 3 months and try again, because you might be able to handle it later on after some more healing has occurred. So definitely our goal is that you can eat a wide variety of healthy foods without any problem at all. That's what I want to be able to have you do in a few months. Now, almost everybody is going to go gluten-free and dairy-free for the first 2 weeks of this program, because you can react to gluten in more of an allergic way and not in a food sensitivity way. And so you might not react to the wheat or the barley or the rye on this on your test results here, because it's testing a different pathway of the immune system reacting, but you could still be having an allergic or an IgE response to gluten in foods that wouldn't show up in this report. And so we do cut gluten because it's a huge problem for a lot of people with autoimmune or other chronic problems. And then we'll try reintroducing it once you're feeling well, and you can see if that seems to be a problem for you. Dairy is also a food that you can have a lot of different ways that you might not tolerate it. So you could react to it in an immune response sort of way. You could also have like more of an allergic response to it, which is not what this measures. It measures sensitivity, not allergic response. And you could also have just like an enzyme insufficiency where you're not able to properly digest dairy foods. And so we do remove dairy for the first 2 weeks as well, and you can bring it back in later once you're feeling well and test it out, see how it goes. Also, make sure that you're continuing to go low sugar on this protocol. Sugar can be very inflammatory for a lot of people. It's going to increase the amount of insulin, which is going to increase inflammation. And so we need to, keep inflammation through all different pathways low throughout this protocol, or it's not going to be as helpful. So make sure as we choose the foods out of your protocol that are going to be safe for you to eat for the first 2 weeks, that you again are reading labels on everything, just like we practiced in Jumpstart. So we don't want to have any unsafe ingredients in those foods at all. As far as just as strictly as you can, follow that rule. Only tested, safe foods that we choose for you. And after 2 weeks, if you're feeling well, we might start to expand that out. If you aren't feeling well after the first 2 weeks, then we're going to let you go a little longer before we start bringing foods back in, because you're not going to be able to tell yet if you're reacting. Now, if we go a little longer and you're still not feeling well, that means there's an underlying condition we need to take care of. So we might recommend some additional testing, have you talk to your doctor about some things. So we want to get to the bottom of whatever the underlying causes, the root causes are. And when we address those, we can get you feeling good again. Sometimes it just takes a little detective work to figure out what it is that's going on. But no matter what we find, you're starting at the right place. Even if you end up being a person that needs some additional testing or therapies in order to feel good, it starts with food for everybody. If you don't have your nutrition in place, if you don't have your gut healed up, then nothing's going to work. So you've got to start with nutrition. just take heart that there is so much more that we can look into and do to help you. So we're going to start with these basic things that help the largest amount of people. Acts as our windshield wiper to clear out the majority of symptoms for people, and then we can tackle whatever's left over. I have yet to work with a client, though, that has not seen significant improvements by walking through all of these steps. So definitely trust the process, follow it as strictly as you can, and know that this is a temporary therapy that we're going through. This is not your forever lifestyle, this limited food choices. Now, for some people, when they are inflamed, they hold on to a lot of fluids, and you can hold on to an insane amount of water in your body without really recognizing it. And so you won't really know if you're a person that holds on to a lot of fluids necessarily until you start to drop those fluids. And so in the first 2 weeks of the LEAP protocol, some people will find that they lose a lot of water weight. You'll find that you're going to the bathroom a lot, and you might start losing a lot of pounds on the scale. So it can be helpful for the first 2 weeks to weigh regularly so that you can see if you're dropping a lot of water weight. Any weight that you lose during those first 2 weeks, especially if it's drastic, it's going to be just water. It's not necessarily fat loss. And I need you to make sure that you are drinking lots and lots of water, at least 64 ounces a day like we practiced during the Jumpstart protocol. Some people will hit the 10 or 14 day mark on their LEAP protocol and start to feel crummy again, and it's because they're dehydrated. So don't sabotage all of your hard work by not drinking enough fluids. Another thing that's going to be really helpful during your LEAP protocol is to keep a food symptom diary. Now, you'll find a sheet in this booklet. If you flip to the very back of it, you'll find a sheet here you can use that is a food symptom diary. So it's helpful to write down the time that you eat, any medications or supplements that you take, and then what food you eat. And we're looking for like detail on ingredients here. So write down exactly what is inside that food. Don't tell me you had a taco. Tell me what was in the taco. And the reason for that is because if you don't keep a food diary, especially a detailed one, and you have some problems, you start reacting to foods, you don't know why, I can't help you figure out what you're reacting to if you haven't kept records for me. So keep a detailed record for yourself and for me. Often if you're keeping the record, it's forcing you to think about what you're eating and forcing you to read the labels and think about what's inside the food, and you'll figure it out on your own. You won't even need me to look through it. But other times it'll be a little trickier and you'll think, I don't know what I'm reacting to. And so if you write it down, you can show that record to me, and I can help you comb through it and figure out where the problem may be. Now, another place that might be a problem for some people is if you're on some medications or supplements, you need to check the ingredients in your medications and supplements. The recommendation is to quit taking any medications or supplements that aren't prescribed by your doctor. Never stop taking something that is prescribed without your doctor's consent first. But often there will be reactive ingredients in those medications and supplements that could prevent people from getting better in some cases. Often there'll be some reactive ingredients in your medications, and you'll find that just by cutting it out of everywhere else in your diet that you're still going to feel just great. So often that's not a problem, but for some people even a small amount is an issue. Be sure, I know I already talked about your PFC, balancing your plate, but it's important that you are including healthy fats at every meal to help you feel full, get enough calories. I don't want you to be starving throughout this process at all, so do your best to be eating sufficient calories and not going hungry. Another tip that I often tell people is keep your foods and your meals that you plan during this phase Very simple. It may be a little bit different than how you're used to eating, but you may find that it's really satisfying, and also it takes a lot of the stress out of deciding what to eat for a meal. Now, just a note on a couple of ingredients that aren't tested for but that are safe for you to have. So one is salt. You can use salt pretty liberally to flavor your foods. Don't worry about trying to eat low sodium right now unless that has been prescribed by your doctor, because you probably are going to be eating a very low sodium diet anyway, just by eating the real foods that you're going to have to stick to on your LEAP protocol. Most of your really high salty foods are going to be fast foods, restaurant foods, canned foods, boxed foods, all of those pre-prepared sort of convenience type foods. Those have a lot of sodium in it. But when you're cooking at home, you're not going to be adding nearly as much salt to your foods as is what's in those packaged foods. Another ingredient that's going to be safe for you to use is baking soda. Now, baking powder, you'll have to be a little more careful with, because baking powder has baking soda in it, but it also usually has cornstarch or some other things. And so if you're reactive to corn, it might cause problems for you. So I would avoid it for the first little while, at least, if you are reactive to any of the ingredients in baking powder. But baking soda is safe. Vinegar is also safe for most people to use, especially if you use a vinegar that's derived from something you're not reactive to. If you're okay on apples, you're probably going to be fine on apple cider vinegar, for instance. And you'll find in this handy little book right here some substitutions and things. So if you have a recipe that calls for baking powder and you can't have baking powder, then there's some handy little substitutions in here. Ask me also if you need some ideas. If you ever get stuck on foods, let me know. I can look through your food list with you. And I've done this lots of times. I can give you some ideas for what foods might be able to broaden your horizons a little bit, so you can feel like you're getting some variety in. We will meet every 2 weeks once you start your LEAP protocol to follow up on your progress, expand your diet as needed, and give you some more instruction and guidance, troubleshoot, whatever you might need at that appointment. So that's all I have for you. I look forward to meeting with you and setting up your LEAP protocol, going over your Mediator Release Test results, and getting you feeling good again. So thanks for trusting me with your health.